Hello, my name is Jose Castillo, and today I'm going to be validating for IV therapy. The first thing we do is we verify the order. So we access the patient record and we see what the doctor has ordered. In this case, he has ordered to start an IV. We assess for procedure need. We confirm that this patient actually needs an IV. The first thing we do is we walk into the room. We perform hand hygiene. We don gloves. We introduce ourselves to the patient. We also want to make sure we can provide privacy for the patient. We also have to identify our patient. So what we do is we check on the patient's wristband and we ask the patient his name and the date of birth. We tell the patient right after that we are going to start a catheter and we're going to start IV therapy because he has lost fluids, and that's what the doctor has ordered. We also need to provide patient safety, so we make sure the wheels in the bed are locked, that the rails are up, and that everything is ready to go. We can then start preparing our supplies, and I will use this as my patient's arm. And so the first thing we do is we prepare a tourniquet. So we put it right over here. And then we assess the vein. Once we find it, we can release the tourniquet. And we can then go ahead and cleanse the site. So I'm gonna use alcohol pads just to make sure we clean the site. And we allow it to air dry. Then we can gather our supplies. And before we start, we have to reapply the tourniquet on the patient's arm. Then the next thing we do is we're gonna actually go and pierce the skin. I'm gonna pretend that this is the needle and that this is the catheter because I don't have the correct tools. So once we find the place, we go inside with both the needle and the catheter. Once we realize that in the small compartment, there's a little bit of blood return, we can then pull the needle off and just advance the catheter. We just advance the catheter. The needle will go in the sharps container. Then, once it's here, we can adjust the catheter with tape. Then the next thing we do, we're gonna pretend that this is not here, but the next thing we do is we actually have to connect the tubing into the catheter. So that's what we do. Before we do that, we have to prime the tubing, make sure that everything is flushed, and we actually go inside of the catheter with the tubing. Once this is done, we can secure the catheter and apply the transparent tape over just the catheter side, not the whole part. Do it like so. Then we remove. remove this part. And we proceed to place a label right over here. I'm gonna pretend this is a label with the patient's name, right here. That's gonna happen just per facility policy. In order to discontinue a catheter, what we're gonna do is we have to again identify the patient. So we check the patient's wristband again. We're gonna ask the patients for their name and their date of birth. What we do next is we just pull the catheter right off the skin in the same angle. We used a 30 degree angle to go inside, and we use the same 30-degree angle to come outside. We do apply pressure with a gauze while we take it out. And then we inspect the catheter. In order to document what we have done, depending on the facility, but mainly what we have to do is we have to say the date and time. So we're gonna say it's September 29 at 6 p.m. We say that the catheter was inserted, let's say at 6 p.m. and it was removed at 9 p.m. This is a 20 gauge catheter that we used. It's located in the lower part of the arm. We only attempted to put it once and it worked, so it was great. We can assess the site, the skin looks good. There is no redness. There's not any signs of any bleeding or anything like that. It was me, Jose Castillo, who started and discontinued the IV catheter, and the IV catheter is intact.